Hello, everybody. I just wanted to say it's so great to be here. I'm really happy to be here and talk to you guys and tell you about my experience. I'm not used to talking in front of a lot of people, so I'm a little nervous. And I don't have anything super prepared except for the questions I was given. And if anybody has any questions at all, I am happy to answer them here, or if you want to pull me aside later, I don't have anything else to do later, so feel free to come up and talk to me, okay? Just going to pull up the questions. So when it comes to heterotaxy, it's something that my mom did a whole lot of research on. She wanted to know everything she could to make sure that I had a somewhat normal, upbringing. I was very lucky to have grown up close to Boston. Boston Children's Hospital is incredible. I feel like they are part of the reason why I've done so well. I've had, a lot of issues growing up. So I was born with malrotated intestines. Asplenia, I found out maybe 5 or 6 years ago. I don't have a gallbladder either. And I have single ventricle, so I had a severely underdeveloped left ventricle. So I've had 3 open heart surgeries. I had, my intestines tacked back into place, untwisted. I've also, like Monica said, I've had several catheterizations just to check in on my pressures for my heart and stuff. And it's been a long journey, but I've gotten to a place now. I'm 33 years old, and I feel really good. I have a great team of doctors who I feel like I can lean on for support, and I feel like anything that I come up against now, I'm like, all right, let's go. Like, I've been through the ringer. I can do this. So one of the questions was talking about a challenging time or a turning point that helped me build resilience. And there's been a few. But in 2018, so 7 years ago, I got this sort of mystery virus. And I ended up going to Boston Children's. I had a fever. I had a rash over my entire body. I was at Boston Children's for about a week, inpatient. And they were really scrambling, trying to figure out, what it was. But I had a lot of support. The doctors were great. I met with someone that helps with like immune system stuff. I had like biopsies. So I really felt taken care of in that moment. And I was able to see the doctors that I needed to. I didn't end up getting an official diagnosis of what it was. But I think after that, I was really like, I can handle anything because, I healed from it. I do have some lingering joint pain, honestly, from it that has been chronic. But like I said, my doctors are there to support me. I've seen a rheumatologist, dermatologist. Again, the Boston area is really great. So I think since then I've had a little bit of a tougher skin just because it was so unexpected. But I think it helped me build a little bit more resilience as an adult after I had already, been through so much as a kid and as a teenager. So what else? Oh, so one of the questions was, how is connecting with other heterotaxy families supported your resilience? Honestly, my mom has done most of the connections. I told Monica when I met the kids this morning, I was like, I don't know if I've actually ever met someone else with heterotaxy before, I think just because it's so rare, you know. But my mom has really been involved in the Facebook groups, and I know some people here, you know, have chatted with her for a long time and know her very well. But that's probably something I can do more of after this is get connected with the families and talk with the kids, because they seem really open to talking about their conditions and wanting to share it with me. So I'm happy to do that. So I think my mom really has been the biggest one to help me with, you know, support regarding heterotaxy, because she hears the stories from other families, other patients, and she was like, we should look into this, like, because I know there's a lot of things that are still being learned about heterotaxy and what it's like to grow up as an adult. Does anybody have any questions for me?
Here, yeah. We have virtual folks, so this allows them to hear it as well.
Yeah. Well, it's nice to meet you. Thank
Nice
you
to meet
for
you
your little talk. I'm another adult with heterotaxy, but I was diagnosed as an adult.
Wow.
So it's all pretty new to me.
Yeah.
It was 4 years ago.
Wow.
So, yeah, you mentioned, I'm still going around different departments and finding out more and more. But you mentioned about the lymphatic system, which is something that I'm quite intrigued about myself. So could you tell me a bit about that?
Yeah. So honestly, it's not a whole lot that I know about. But I have had, and this is, you know, very basic, but I've had a lymphatic drainage massage before. And I found it really helpful with extra fluid, just like helping to move it throughout the body. I do feel like I don't have a great lymphatic system. I'm not really sure why.
I'm so fascinated by this because I'm going through exactly the same thing, and
Yeah.
it's all self-taught. Like I'm learning myself. This isn't coming from my medical
Right.
care.
Yeah.
But
and
I'm quite passionate about this, so I was very interested.
Yeah,
in that.
and it's tough because I think the doctors are learning at the same time that we are.
Yeah.
You know, there's a lot that they still don't know either. So I've been asked, usually when I come into Boston, to participate in studies. And I feel like that's been really informational, even though, you know, they're just studies, they're just learning. I do get results from the studies that I participate in. Sometimes I get a little money too, which is nice.
Bonus.
But, you know, they're still learning too. So I think keeping up with, you know, the current research that's going on is good. And also, you know, talking to other families like my mom has, and, you know, hearing their experiences, and then, you know, looking into if you've had similar experiences or if you might at some point. So I feel like there is a lot that I've dug into as an adult that I've found out. So you know, I didn't know I didn't have a gallbladder, and growing up I had some digestion issues, you know, not super terrible, but they were unexpected, and it was confusing for me to be like, you know, why is this happening? And then to find out later that I don't have a gallbladder, I'm like, well, gallbladder probably would help with that. You know?
Yeah, absolutely.
So yeah, it's tough. I really don't know a whole lot, but I'm learning probably at the same pace that you are.
Yeah, it's really inspiring hearing your story. I'm going to have a lot of
Thanks.
questions, I think, and I don't want to take over your podium, but yeah.
No, yeah, I'm happy to talk.
I mean, there's one more. May I? So I've recently been diagnosed with bile acid malabsorption and had issues with my pancreas. And that's just something else that I'm wondering is linked to heterotaxy. And I don't know if you suffer with sort of bile issues because of your lack of a gallbladder.
I don't think so. I've never been diagnosed with that before. But I think I have heard of that. What exactly is it?
To be honest, I'm learning myself.
Okay.
But yeah, it's you know,
Probably going to be a lot of that.
it's a bit early in the morning to go into it too much, but
No
I
worries,
suffer
no
sometimes
worries.
with like a chronic diarrhea from it.
Okay.
And that kind of
Sorry,
that kind of thing. But I'm sort of intrigued.
Yeah.
Into the GI issues as well. I've got malrotation, and so I don't know if it's all linked.
My malrotation was fixed when I was very young. So maybe that's why I don't have those issues as much. I've kind of had the opposite issues before.
Okay.
I think just issues with digestion in general, fiber and stuff like that.
Mm-hmm.
But that is something I don't know that much about. I'm so sorry.
No problem. Thank you.
Yeah, of course.
Hi, I
Hi.
came late to your talk. I'm so sorry. I missed the lymphatics part, but
That's okay. It wasn't a lot.
I don't think you were here yesterday. My husband talked a little bit about our son who had passed away, but we had a lot of lymphatic imaging and work done on my son. He had a lymphatic embolization. He had a lot of lymphatic leaks as a result of some of the of a revision Fontan going not well. But the point is that I think we might know the most about lymphatics and who's in the space and who's working on it.
Yeah, you
and what
probably
can be
know a lot more
done.
than I do.
So find me at some point if you have questions.
Yeah, yeah, totally.
Or if you want to ask.
And you mentioned rheumatology, that you've been under rheumatology, and again, I'm going down that path, and so what?
Yeah, so the rheumatology road has been tough, not gonna lie. So ever since I had that, the virus that I talked about in 2018, I started seeing a rheumatologist, getting a lot of rheumatology blood work done to find out, if I had an autoimmune disease or something. Everything has come back negative except for ANA. My ANA has been high. You might be familiar with this, and I'm
Yes.
like, I have chronic joint pain. Every morning when I wake up, my hands are stiff. Before it rains, when it gets cold, I get joint pain, and I don't know why. I've actually seen a couple of rheumatologists because I wanted more opinions, and they kind of all told me the same thing. So I'm still looking for answers there, but I think rheumatology, at least, when it comes to heterotaxy, maybe doesn't know as much as they might, that we might want them to. So I'm still seeking answers there. But yeah, that's definitely a struggle that I've had the past 7 or so years.
Well, thank you.
Yeah.
It's so interesting, honestly. It's great. Thank you for being so open.
Of course, yeah.
Alicia, would you be willing to speak to any memories or anything you would say in your transition, say from high school into adulthood? Because a lot of us that have younger ones, helping our kids make that transition, there comes a point where we're not allowed to do stuff in the medical system. And what was your experience with that?
Yeah, so my mom definitely had a hard time with it. She still really wanted to be involved with everything and wanted to know what was going on, but I was becoming an adult, and I wanted to, be more involved with my care and learn more about my body, because there was still a lot that I didn't know that maybe my mom knew more about. I transitioned to the BAC, the Boston Adult Congenital Heart Team. I think I was like 19. And it was really hard to not see my cardiologist anymore, because I had, grown up with her and we had gotten very close with her. But the adult team was really great, and it was good to hear from them, what other patients were experiencing and, things to think about for the future. So like planning for maybe kids or, stuff like that, wouldn't have talked about when I was a teenager. I also, when I was 18, I had my last open heart surgery, my Fontan revision. So that was right after I graduated high school. So that summer after I graduated, and I was signed up to go to UMass Lowell in the fall. And I was like, no, I think I can make it. But the recovery after open heart surgery at 18 was tough. And I think I really wanted to, do the same thing that everyone else my age was doing and go to college and be normal. So that was really hard. I ended up still going, even though I was still recovering and I was really tired. I ended up driving, 30 minutes every day to classes at UMass Lowell. Still tired, still, on pain meds. I probably should have waited a semester, but I didn't want to fall behind. So I think that transition is tough, because you're still dealing with, all of your medical stuff, but you're also growing into adulthood, and you want to do all the things that adults, are doing. But when it came to the doctors, they were really great, especially the Bach team, because I got to see a new rhythm doctor. I can't think of the name. I got to see a new nutritionist to talk about, what I should be eating and stuff, which I had been to a nutritionist before in high school, but that was because I wasn't gaining a whole lot of weight and I needed to gain weight. But it was nice to learn from a new team what my adult life would look like and what I would have to be thinking about for the future.
And a follow-up question.
Yeah.
Do you see all of your specialists through the adult care system at Boston Children's, or do you go into the adult world and find specialists for various things?
So most of my specialists I see through the Bach team in Boston, but the rheumatologists, I've seen a couple of them, have been outside of Boston. And then I think there was a dermatologist that I saw that was outside of Boston, and it's tough because they don't know your history and they don't know, how things can affect you differently than normal people. So I prefer to go into Boston. I will drive into Boston anytime to see my doctors because they've been able to give me the best support. I did have an experience with a primary care nurse practitioner from just like a small, where I went to see my primary care normally outside of Boston. That wasn't so great. So I was having anxiety about, sorry, I hope you don't mind, I tell a little story about this, but I was having a lot of anxiety around the rash and the joint pain and things, just not knowing what was going on. And so I went to my primary care and I was like, is there anything you can do to just help me like chill a little bit because I'm having a lot of anxiety. I grew up with a lot of anxiety. And I didn't get to see my primary care doctor. She was busy, so I had to see a nurse practitioner. And she was like, yeah, we can prescribe you something. So she prescribed me a medication. She's like, just take this when you're feeling anxious. And I was like, okay, cool. So I started taking it. Maybe a couple days later, I started feeling chest tightness. And that made me even more anxious. I was freaking out a little bit. So I was like, well, this medicine's for my anxiety. Took it again. And I kept feeling that chest tightness for a couple of days. Luckily, I had a virtual appointment with the Bach team, like maybe 4 or 5 days after this has started happening. And they're like, how are you feeling? And I was like, well, I've been having this chest tightness. I have a lot of anxiety about, my rash and, everything that's going on with rheumatology. And they were like, what medication were you put on? So I told them the medication. They were like, you should not be taking that. You should stop taking that immediately, because you shouldn't, as a heart patient, you shouldn't be taking that medication. That's probably what's causing your chest tightness. And I was like, oh, okay. So now going forward, if a doctor outside of my Bach team prescribes me something, I run it by my doctors. Even if it's just sending them an email or sending a patient portal message, being like, hey, my psychiatrist, my primary care wants me to take this. Do you think this is okay for me to take? And I wait to hear back from them before I take it. Because, small doctor's offices, even ERs that aren't close to Boston really don't know a whole lot, and I have a long complex history, and they just don't know how to care for me the way that the experts do up here in Boston. So yeah, it's scary. It is scary out there because we are so complex and different, and there's a lot going on. So yeah, my doctors have just been great. It's good to get their opinion on everything. Go to all your doctor's appointments. It's worth it. I know it's annoying, and I've used up a lot of vacation time on all of my appointments. I run out of sick time a lot really quickly, but it's worth it because I feel good and I feel like I'm on top of everything. And I'm able to do the things that I like to do, like painting and dancing and drawing. I go to a belly dance class every Saturday that I am obsessed with. I have so much fun, but I really couldn't do any of it without my team of doctors. So, yeah. Sorry, that was a long-winded answer.
Questions? Okay, I was going to ask.
Just wanted to say thank you for sharing your story. It can be a little nerve-wracking.
Yeah.
So we do appreciate that. One question that I did have, most of us, it's our children who have heterotaxy.
Right.
And my question is what is the one piece of advice that you could give all of us how to best help our children through this?
Oh, that's a big question. I think for me, really being able to invest in things that I enjoy outside of the medical world was incredible for me. I read a lot of books in high school. I was very shy, but books were, like, I love to read fantasy, so those were sort of my escape. Yeah. And in high school and early college, yoga was great for my anxiety and honestly, my heart too, because I had some issues with arrhythmias in college, but the breathing exercises of yoga helped a lot. Just calming the nervous system, which is, really connected to the electrical system of your heart. So I think finding that balance between, learning everything you can, while at the same time letting your kid just be a kid and just do the things that they love to do, and enjoy themselves. I definitely felt like the medical kid, like the weird one who, I have to go to the doctor's office to eat a Twinkie because I have to gain weight, and people are like, what? Or like, I take 5 medications every morning. My life was different from other kids, but I really wanted to feel normal. And I think finding that balance between, knowing that they're special and they have a lot of needs compared to other kids, but also being able to do normal things. I also found a lot of support in the summer camp that I went to growing up. The Madden Open Hearts camp in Western Mass was incredible. So it was only for kids with congenital heart defects. So I got to meet other kids, and the nurse was on top of all of our meds. They made sure we had enough water and shade, and we didn't get pushed past our limits when it came to exercise. And I think that really helped to make me feel normal a lot. So I went there for years, probably longer than I should have. But having that support, feeling like there were other kids like me, helped a lot, because, like I said, in a regular school, I felt like the weird medical kid who had all these issues. I remember going to high school with a heart monitor and having it beep in the middle of class in high school was terrifying because then come the questions, and you know how teenagers can be. So there were times like that where I felt different, and I was like, nobody's gonna understand this, and I barely know how to explain it at this point. So yeah, I hope that helped. I hope that answered your question. Yeah, okay. I could take one more if there's time. Anybody else? Okay, good.
So I have a question, but it's probably not the best to end on. So I don't know. You'll have to make of it what you want.
Okay.
So I love how you're like on the other side of transitioning to adulthood and everything. And I'm wondering, because the statute of limitations has probably run out. You don't have to share if you don't want to, but I'm like, are there any things that your parents said, like, no way can you do this, and you just did it without them knowing? Because the kids here often do things that their parents are like, no, you can't do that, or they just do it in secret. And so I'm like, tell us what you survived so we can relax, I guess. Does that make sense?
Wait, okay, I feel like I need examples of what these kids are doing.
So like I went to one thing with like adults, and like some with a Fontan went skydiving, and with the circulation like passed out.
Oh my God,
like, and it was in
no.
front of cardiologists. It was hilarious just watching them like all freak out. And so the kids like, I do this for sports, like, because they're like, I just want to feel alive after I've been so protected. Or like sometimes you want to risk. And I was like, okay, but you don't need to have gone skydiving. But I also think that a lot of the kids will just do stuff, and it's that tension developmentally between independence and teenagers are really like, nothing can harm me. And they also like really push against parents, because that's how you're brave enough to go out on your own. And you did, right? Like, even though you're like, I'm going to have heart surgery and I don't feel the best, but I'm going to drive with painkillers. It's cool.
Oh, God.
Like that's the kind of stuff though that like develops who you are. So I'm like, you don't have to say anything, but I was like, or you could just say, yes, I did things.
So
Yeah.
I
She's
wasn't
not here.
I wasn't a huge risk taker. I think because I was very sheltered by my parents, and there was a lot of, you can't do this and don't do this, no roller coasters, no contact sports, no heavy weightlifting. Not that I was interested, but I think the two things that I was kind of interested in, but my parents were like, I don't know how, like we weren't told a complete no, but it was like, it's probably not great, is drinking and smoking. I wasn't super interested in drinking, actually. I didn't really drink in high school much at all, or in college. Smoking I was interested in. I have had a few experiences, okay, maybe like two, where I passed out. But I was okay. Yeah. When it comes to the smoking, I think it's like a blood pressure thing. Just like really lowers your blood pressure, and I think that's what did it. I did almost pass out on an airplane once. I think also like a pressure thing with my best friend. Who was kind of clueless. I was like, I think I'm gonna pass out, and he's like, oh, me too. like no, like, and we had to get the flight attendant. But I'm not interested in skydiving. I'm good on that. I know that like hard drugs are not good for me. I think just knowing the danger has kept me away from a lot of stuff, because I'm like, I enjoy my life without those things. I don't need them. Maybe a little smoking, but but I have talked to my doctors about it. You know, I have conversations with them about everything. You know, I don't hide anything from my doctors, and they're like, okay, well, you know, it's probably not great, but it's fine. As long as you feel okay, there's been no issues, like basically none. So yeah, I'm not a super risk taker, but I've taken a few risks just, you know, because I had a very sheltered life and very protected. And I was like, well, I want to do something fun, you know, it's like, I want to feel normal and have fun. But knowing the risks going in is definitely good. Yeah. Yeah, no problem.
Alicia, this is such a valuable connection that that you're willing to share with us. An adult perspective for a lot of us is a brand new thing, because a lot of us didn't want to think about our children going into adulthood. We were kind of stuck in the now because there's a lot of things happening now, and it's really inspiring and it brings us hope. To have you here and to share all of your insights and experiences with us, and even some of the secrets. So let's give Alicia a big round of applause. Thank you so much.
Thank you. Thank you so much.